This is Sandy Tankus for TOS50.com, and I'm here today speaking with Dr. Lyle Leipziger, who is the chief of the Division of Plastic Surgery at North Shore Hospital and Long Island Jewish Medical Center. And Dr. Leipziger is actually going to be speaking to us today about improving our appearance by using plastic surgery. And and good morning, Dr. Leipziger.
Good morning, Cindy. Thank you. It's a pleasure to be here.
And it's a pleasure to be speaking to you. Since these days, both men and women have plastic surgery to improve their appearance, how young or old should a person be to get their best results?
Well, there's no question that plastic surgery is all around us. You can't pick up a newspaper, a magazine, turn on a TV without seeing some reference to plastic surgery. So feeling good, looking young is in a lot of people's minds today. And it's no longer really about age. It's about what you want to look like. So people are coming in at all different ages when they look in the mirror and they see something that bothers them. They want to improve on something. So it's really no longer about age.
So I'm talking about having your eyes done, wrinkles removed from your forehead, that type of thing. I mean, if you're in your 80s, that's not too old?
But it's no longer, it's actually interesting that you said that because it's no longer about age. I found that it's about health. And if people are healthy, they can have surgery done at any age as long as they get a thorough medical evaluation. Now, people are coming in wanting certain things at certain ages. The concept is many women today, and also men, don't want to really see the aging process. They're working out, they're taking care of themselves, they're dieting, they're exercising, yet sometimes they look in the mirror, they feel great on the inside, and they don't necessarily see that when they look in the mirror. So the concept that I found in my own practice, where people are coming in a little bit younger to have more minimal surgical procedures to look better longer. And so the shift has moved to younger patients coming in for various things. When I mean younger, you mentioned about having a person coming in their 70s or 80s for a procedure. Well, women might come in for a surgical procedure in their late 40s or early 50s for, let's say, some facial work. They might look and see, early in life they have genetic predisposition to sort of heavier eyes or bagginess of the lower eyelids earlier on. They may not want to wait till they're in their 50s. If it's something that could be done earlier, even in their 30s, some women are coming in for that just to look better.
And are there particular procedures that are more popular than others that people are having done?
Well, I mean, that's based on what people want, individual desires. If you look at national statistics, breast augmentation has been a very popular procedure in terms of a national statistic. Liposuction has been very popular in terms of a national statistic, followed by other body improving procedures.
Are there people who actually shouldn't be having surgery? For example, I know women who've had what's called a facelift, and they look great for about 6 months, and then what happens is the wrinkles that were there before come back. Is there some way that you can ensure that your facelift stays lifted?
Well, the most important thing is to have a comprehensive consultation and have realistic expectations. So you need to understand what the problem is in order to fix the problem. And you should approach a plastic surgeon that has experience in the procedure that you want particularly performed. You mentioned about who's a good candidate and a bad candidate for plastic surgery. Well, as I mentioned earlier, health is very important. Someone that has multiple medical problems might not be a candidate for plastic surgery, and that whole health history needs to be reviewed by the doctor. Also, somebody with unrealistic expectations. A patient may come in and say, I want to look like a certain movie star, or I may have certain unrealistic, well, that person would not be a good candidate for plastic surgery.
And if you just wanted to sort of have a few years taken off, what would be the best surgery to have done?
Well, that's sort of a catch-all question. It really depends on what you wanted and what can be done safely and effectively for you. So you need to go to a plastic surgeon, get a comprehensive consultation. You discuss the things that bother you with that plastic surgeon, and that he or she would evaluate you in the best possible manner, tell you what can be done safely and effectively for you.
Is there any danger involved in having these operations?
Well, any surgery I consider to be a surgery. So it's important that you dot the I's and cross the T's. You get a complete medical evaluation prior to the procedures. Make sure the patient has realistic expectations, and then you take precautions for the surgery, both preoperatively, during the time of the surgery in the operating room, and postoperatively.
Well, thank you so much for speaking with me today. It's been a pleasure.
It's certainly a pleasure. Thank you so much, Sandy.